Cat owners urgent alert. Bird flu is spreading. Section 1. A drastic surge. The new reality of bird flu in cats. Scientists have uncovered a troubling trend. There is a sudden rise in bird flu infections in cats. A new review from the University of Maryland confirms this. Researchers looked at 2 decades of global data. They found a dramatic increase in cases. This surge happened mostly in 2023 and 2024. The findings signal a significant shift in how the H5N1 virus is behaving. The virus is no longer confined to birds. It is now finding a home in mammals that live closely with us. This development has put public health experts on high alert. Symptoms and high stakes. When H5N1 infects a cat, the results can be devastating. The current strain has a fatality rate of around 67% in cats. It primarily targets the animal's central nervous system. The virus causes acute encephalitis, severe inflammation of the brain. This attack on the brain leads to frightening neurological symptoms. Infected cats may suddenly experience seizures. They can become disoriented, unable to recognize their owners. Paralysis is also a common and tragic outcome, leaving the animals helpless. The symptoms are so severe they can be mistaken for other diseases. The aggressive neurological signs often look like rabies. Cats may exhibit unusual aggression, unsteadiness, and excessive drooling. Only after testing is the true cause revealed to be H5N1. Some infected cats have gone completely blind. The rapid onset and severity make the disease heartbreaking to witness. The virus's ability to spread is not limited to cats. Section 3. Unraveling the web of transmission. Scientists are working to understand how cats are getting infected. The routes of transmission appear to be varied and growing. A primary way is direct contact with sick birds. Roaming cats may hunt and eat wild birds carrying H5N1. Other pathways bring the virus closer to home. On dairy farms, cats have become sick after consuming contaminated raw milk. The virus can be present in milk that cats drink. Pet food is another source of concern. Multiple outbreaks have been linked to contaminated pet food products. In December 2024, several cats in Los Angeles County became ill and died. Their sickness was traced to recalled raw milk tainted with H5N1. Oregon reported numerous cases linked to contaminated raw pet food. Cats displayed severe neurological symptoms, including seizures and tremors. Many were too sick to be saved and required euthanasia. In Colorado, 2 indoor-only domestic cats tested positive. They had no known contact with infected animals. This raises urgent questions about new and unknown transmission routes. Possibilities include contaminated shoes or clothing, or environmental sources. Cats can also be infected by eating exposed house mice. Protecting pets and people. In light of the surge, scientists are making an urgent plea. Surveillance of bird flu in domestic cats is critically lacking and urgently needed. Cats could be the silent bridge that allows the virus to cross into humans. Experts urge public health authorities to begin active surveillance programs immediately. Programs should focus on cat populations on farms, animal shelters, and areas with known avian outbreaks. For pet owners, there are clear, simple steps to take. Avoid feeding pets any raw food products. That includes raw pet food and raw dairy milk. Keep cats indoors during local bird flu outbreaks when possible. Reduce encounters with sick birds or other infected animals. Watch pets closely for signs of illness. Look for strange behavior, weakness, seizures, disorientation, and vision problems. If any appear, act fast and contact a veterinarian. Mention outdoor access and any raw food exposures to speed diagnosis. Shelters and farms should use gloves, wash hands often, isolate sick animals, and test promptly. A calm but urgent response, surveillance, and sensible precautions offers our best defense.